the hand feedback. Thank you for starting that recording, Andrea. So if you could just raise your hand so we know if you are a first-year student or a doctoral student, but someone who's planning to do or contemplating doing a global health internship, just so we know how many we have who are thinking of this or in the room today. About 7 or 8 or so. 9, okay, 10, yeah. Okay, great. Okay, and then everyone else, I think maybe here is just sort of here to listen and understand. This session we do every year through the Bixby Center in Population Reproductive Health in conjunction with the Center for Global and Immigrant Health. And I see now we do have a number of people who joined. So the Bixby Program Assistant, Andrea, will be helping me with this presentation, and she also is asking everyone to sign in today so that if we get more information, we can send it to you. So there is a sign-in sheet. So what we're going to do today is that we're going to go through some slides with you about, and then have also a Google Doc that we'll be looking at about internships that we know of, that our students have done in the past. And we also have a few people here today who did global internships this past summer. They did them all remotely. And so when we get to a discussion of that particular internship, I'll ask them if they would say just a few words, maybe a minute or two, on what that internship consisted of. So let's get going, because I do want us to be done by 12:55. So I'm going to share my screen. So as I said, we're here today to talk about international internships, not just in the areas of population and sexual and reproductive health, but just in general. And so first, we just want to give you some key information. So everyone, of course, is wondering about funding. Last year, we were able to give everyone about $2,500 in funding. And that's what we expect this year, unless it becomes possible for people to travel. So if people are able to travel, then there might be availability of additional funds to cover airfare and visas and other kinds of things associated with international travel. So if you have any specific questions on this, you can reach out to Michelle Garcia, but she won't have anything more at the moment to say about this. It's still under discussion. So when do you apply? Well, you'll be getting a form shortly, probably within a week or two, with information about how to apply. But what we expect is that applications for internships, again, will be, as they were last year, on a rolling basis. So that means that you will have a first opportunity to apply probably in the first week of May, and then can apply again 2 weeks later, and so on. So there isn't the absolute urgency to have everything lined up by beginning of May, but of course, the sooner you can line up your internship, the better, and then you can focus on other things. Remember that if it's an internship where you're getting fieldwork credit, it has to have a preceptor with at least a master's degree. Ideally, it's somebody with a master's in public health or a PhD, but at the very minimal is a master's degree. You can also combine remote internships. So this worked last time for people. Like sometimes a remote internship, it's hard to get 400 hours of it, but maybe you could do 200 hours of one internship and 200 hours of another, or work with a faculty member for another set of hours, or mix and match 300 with one, 100 with another. So something also to think about. And also, if you're planning to try to obtain the Global Health Certificate, this year you can use an internship that doesn't require any travel, because of course it's probably not going to be feasible. So you could have an internship with an organization based in the US that's working on global health issues or working on refugee or immigrant issues, so that you can get some skills that way. So before I go any further, are there any questions just on this information on this slide? So feel free to just jump in or use the chat. Okay, so let's keep going. So next, these are internships that we have identified that people have used in the past, where people have gone to these locations and had internships with these organizations, UCLA students that we have vetted, that Andrea has spoken with, and have had what we consider is a good experience. Not necessarily fantastic, but good and an acceptable experience, where they've had involvement with a preceptor, they have done some interesting things, and so on. So what we're going to do now is we're going to look at some details of those specific internships. And I'm going to just stop this for just a moment. So Andrea has put up a link to a packet. So I'd like to ask everyone now to open that packet, and we can look on it together. So this packet has all these specific details on eligibility, preceptors, and so on. So if everyone could get into that packet, and I will also be sharing that packet on through the share screen, but you might have difficulty seeing it's a small kind of print. So if you could open your own, that would be best. But I'm going to now open again the share screen and get to my own packet now. So so we can see from this packet, those are the identified internships. And so let's go through them one by one. Andrea, everyone can see this? You can see it? Okay, great. So the first internship is with a former UCLA doctoral student, Dr. Vantanak Sapphon, and he is from Cambodia, and he is now a professor at the University of Health Sciences in Phnom Penh, and he's always seems to be able to work effectively with epi students or biostat students with some of his data sets. So it's worth reaching out and finding if there is something interesting that he's working on, and you would analyze data along with him and so on, and work on publications. So again, that's really only for an epi or biostat student, and you have to be able to have a very strong familiarity with STATA and possibly also with SAS. The second internship is with the organization KANA in Cambodia. And for this internship, we had a number of students who did do an internship with them last time. So let's start with, let's see, Kirsten, you did an internship. Would you be willing to share your experience?
Yeah, sure. So I don't, want to take up too much time, but kind of generally, although it was, done virtually, you kind of get exposed to many different areas of public health. So me and some of my peers were able to kind of work on like annual reports that they were putting together. We got to help edit or contribute to publications that they were already started. So they were drafting to submit to different journals, mostly relating to tuberculosis and HIV/AIDS. We also got to do our own independent research projects. So for over half of it, we were familiarized with an HIV project that was working with female entertainment workers and sex workers in Cambodia, and trying to figure, it's called the Mobile Link Project, and trying to figure out how to connect these female entertainment workers to HIV/AIDS resources. And we were able to use the data collected from that project to do our own independent research using Stata, and then writing up papers. And then we had the option to kind of pursue it for publication in journals or not. So I don't know if anybody else is here that worked with me that would like to add anything else to that or not, but I had a great experience.
So that's Kirsten, and then I understand, and Kirsten's in CHS, and then also Laura was also had an internship experience. Maybe you can describe yours?
Yeah, I think Kirsten did a pretty good overview. So I feel like our main tasks were working on the Mobile Link project to evaluate it. And then we also got to like work on our own research project from that data. Something to add would be for me, I went into it with not having a research experience outside of the classroom, but I thought they did a really good job at like introducing us to Stata and saying like exactly how to use it. They had us like work with Dr. Brody, who is at Toro University. So she kind of like introduced us to a lot of like data analysis and tools we could use in our publications.
Great. So Laura, are you also CHS student?
Yeah, I'm CHS too.
Okay, so this is an opportunity where they aren't specifically looking for an EPI student. So you could be an EPI or a CHS student. But last year we felt a bit too many interns, people who had applied. So we have requested that they limit it to 2 to 3 interns this year so that it's not overwhelming a small organization. So KANA is largely, as Kirsten and Laura said, is talking about working on HIV related projects. And then if you go further in the packet, you can see their ongoing projects. So it's the community mobilization. There's the initiative to end tuberculosis in Cambodia. Sorry, there's the implementation evaluation of community-based ART. There is a chat line, a WhatsApp chat line, and so on. So I think it's this mobile link that both of you are working on. And also there's the NCDI activities. So there's a range of stuff. So so we do though urge you to have some proficiency in data, some software, and then these are the 3 contacts. Is Dr. Brody willing to be involved again this coming summer? Do either of you know, Kirsten or Laura?
I don't know. If I had to guess, I would guess probably. She's been working with them a number of years and supporting their interns, but I don't know for sure.
Yeah, okay. So she's a colleague of mine. She actually had identified this years ago when she was working in the UC system. And so she's a terrific resource as well, and she's at Turo. So while we have Kirsten and Laura here, do you have any specific questions, anyone in the audience, for either of them on this internship? Because I don't want them to have to hang around if they don't feel like it. But also, you know where to find them, and I'm sure that they'd be willing to talk privately afterwards and give you more input into how to navigate this internship.
Yeah, I can put my email in the chat if people have questions later or something.
That would be great. And if Laura, you could do the same if you wouldn't mind. Okay, terrific. So let's keep going. Then our next internship is with Doorbar in Calcutta, India. And again, another remote opportunity, but this is quite a fascinating organization. It's set up just to work for and with sex workers. In fact, it's sort of like a sex workers union. And so if you're very interested in sex work and HIV and other diseases and violence and problems that sex workers face, then this is a good internship to potentially consider. If I just go down here, but before you would get too far into this, we really urge you to have a conversation with Dr. Dallas Windeman. He is an associate professor in residence at UCLA, and he did his doctoral work in CHS and working with this particular committee. So you can get good input from him about the pros and cons. And of course, it's also might be a little more difficult to work with an organization like this remotely, because the people, some of the activities are really doing outreach to other sex workers and things of that nature. But he would be able to guide you. So next, there is a new organization. It's called Formidable Joy. Not sure how it got that name, but it's actually working on improving access to clean water. And it's based in Malawi in East Africa, but it also has a remote office in Los Angeles, or an office in Los Angeles. And again, it's a remote internship. And so a lot of this internship would involve writing grants for this new organization, try to raise money, and also to assist with small projects. But the people involved are, here in Los Angeles, and really good people who've been involved with NGOs and working in Africa for a number of years. I know Karen Samam personally. So if it might interest you to work on such an internship, that's an opportunity for you. Just going to take a second just to close down my, I see that my emails keep popping up, so I'm just closing that down. So next we have Population Council. So Population Council has offices in New York, and then they have field offices in various regions. So 3 field offices that our students have worked in the past and had successful internships are in Mexico, Mexico City, specifically in Nairobi, Kenya, and in Lusaka, Zambia. But there's other offices they have as well as a New York office. And so these are descriptions of internship opportunities in these 3 different field offices of Population Council. But if you're interested in possibly working with the New York office on some global health issues, I would urge you to contact either Dr. Jessica Gibson, who's in touch with people who work there, or Dr. Randall Kuhn. So in Mexico, you can see that there is a number of 4 different projects that they're working on. And they do recommend that you speak Spanish, not necessarily fluently, but that you have some proficiency. Then we have Population Council in Zambia, and there they have also a number of different activities. And so it'd be mostly doing like data analysis, report writing, and they really want people with very strong skills. And you'd be working directly with 2 of their contact people there, I think Professor Mbizwo or Dr. Kavevi. And then lastly, the one that we have had the most students work for in the past is the Population Council office in Nairobi, Kenya, and in particular with this poverty, gender, and youth research team. So if you're interested in issues related to impoverished youth, particularly like youth in informal settlements, or what we call slums, in Nairobi, they do have a number of activities there. Looks like they're also trying to understand what's going on with COVID and adolescents, and they're doing something outside of Nairobi. It looks like up in a pastoralist area, probably up in northern Kenya. But again, it would be a remote opportunity. These would be a lot more exciting if it weren't remote. Then we have KEHEF. So students have had really good internships with KEHEF. It's located in Kampala, Uganda, which is about a 3-4 hour drive from Kampala, the main capital of Uganda. And KEHEF is based in a community setting, but it does have a hospital. It does have a lot of projects going on. So it's been a really fun place to be. They have a dorm and they take on a number of interns in the summer. But even without that international experience, Dr. Jeffrey Anguyo, or you just can call him Dr. Jeffrey, is really eager to have a couple of interns this summer. And you can see a number of activities that he could envision people working on. So for instance, community insurance, health insurance program, a rabbit program to improve nutrition, then a program to improve quality of healthcare, and so on. And even they have a community-based research assistance program, but that's hard to imagine exactly how one would be involved with that. But anyway, he's really eager to talk. So if you're interested, you could set up a Zoom conversation with him, recalling that there's about a 10 or 11 hour difference to Uganda. So it's best to either call late at night, our time, or very early, early in the morning, like around 7 a.m. or 10 or 11 p.m. Then we have next opportunity is the Mexican Institute for Social Security, and this is IMSS. It's called IMSS, but essentially this is an enormous database. About 40% of the entire Mexican population gets their health insurance through this entity. And Dr. Yvonne Flores here at UCLA, she has access to that data. And so can really set a student up with doing some very interesting research, but this pretty much should be limited to epidemiology or biostat students, because it's really just working with these data sets. And Spanish is desirable because the data is in Spanish. I mean, you could theoretically do some translation of it, but if you have at least some working Spanish, it would really make it a much better opportunity. So again, one could do this remotely and be, looking at the data and developing some topics, and she would guide you. And most students who do this end up with a peer-reviewed publication at the end, or at least a publication ready for submission at the end. So it is a really excellent data set. Then we have number 10 is Cure America's Global. And this is a newish opportunity. This is one that I know we have one student from UCLA, Nilpa Shah, who participated last summer, and maybe she can discuss it with us right now.
Yeah, hi. So I'm a second year CHS student, and I interned with Cure Americas this past summer. So I was responsible for doing a process evaluation for one of their projects in Kenya. It was the routine home visitation project, and I believe at this moment they're hiring students for the Haiti project, which is the CARE group, which is kind of concurrent project going on in Kenya as well. So during my internship, I was able to work with the preceptor, and also the preceptor is in North Carolina. So they're domestic. However, the project itself is in Kenya, and we had a few stakeholders there. My work in with Cure Americas was I really enjoyed it because I was able to use the skills from 211B, able to do a background review, develop interview guides, and also do data analysis, which is kind of further up from 211B. But 211B really helped me kind of frame the questions, frame the research, and develop the methodology, because the intern was responsible for all of that. So I would say some of the skills that were really helpful during my time was knowing Excel, knowing how to use formulas, and also knowing how to do qualitative analysis. And they were pretty open with any type of software or any means that you are familiar with. So yeah, I'm happy to answer any questions that you may have.
Great, thank you so much. Does anyone want to ask Nilpa a question while she's here? Maybe she can also put her email contact into the chat. Okay. So Nilpa, if I might ask, did you need any language other than English?
No, they interviewed, so I had to create an interview guide in English, and we submitted it to the team in Kenya, and they translated it and asked the questions to the community health workers who we were interviewing, and they also translated the interviews back into English for me to analyze.
Great. Okay, so that was really nice. Yeah, so that you were able then to have something really concrete to work with.
Right.
Great. So it looks like they have a spring opportunity. So somebody could start pretty soon, it looks like, if they wanted to do it maybe in parallel with your classes, maybe on a part-time basis. And then they also have a summer. So you can see they have spring, and of course that's much more, they figured that one out more than what is in summer. Summer, they're still, it looks like, working it out. And they also give their own stipend, it looks like, but that would not preclude you from also getting some funding from UCLA. Okay, so there, Nilpa, thank you so much. And you're welcome to hang around or leave, but really appreciate your telling us about that internship. And then we have one in Bangladesh with the International Center for Diarrheal Disease Research, IDDRB, ICDRB, so it's called. And I should mention that even though it has diarrheal disease research in its title, because that's what they started in working on oral rehydration therapy way back whenever they started in the 60s or 70s, they have branched out and they do all kinds of activities now in family planning, HIV, child health, and so on. So they have really gone well beyond diarrhea. But it's also a challenging work environment, whether it's remotely or on location. So before you might want to consider that, we do urge you to first discuss it with Dr. Kuhn, who has a lot of contacts there and has done some research with them, and he can maybe help guide you to what might be a good preceptor arrangement. But there are some difficulties of communication, just a lot of barriers and issues. So if it really, you want very much to work with Bangladeshis, which I would completely understand, this is their most notable research organization, but it's just to be aware that you have to be very proactive if you're to work there. And then lastly, I shouldn't say lastly, we have a few more, but then we have the University of Cape Town, and that is in South Africa, and just a beautiful area. If you haven't been to Cape Town, it's like San Francisco. It really has that kind of spectacular scenery and everything. And we have Dr. Devora Joseph Davey, who is living there, and she is an adjunct assistant professor at UCLA in epidemiology, and she has opportunities for 1 to 2 epi students to work with her, again, remotely unless things change, on research, very exciting research that she's doing on PrEP and HIV negative pregnant women. And there's a lot of interesting issues, and she has given talks on this, and I think could share with you some of her past presentations, but she's really wonderful to work with. And I think if you are an epi student, this could be a very enjoyable internship. And then we have Arth Action, Research and Training for Health. This is an organization based in India, and Dr. Sharad Iyengar is really a notable feminist researcher and is very interested in advocacy as well as other kinds of issues related to sexual reproductive health, maternal health. So very interesting, exciting work. Again, could be quite challenging to work remotely with Dr. Iyengar, but it'd be worth exploring this if you have an interest in India and, could come up with some interesting things to do. And as you see, they're also getting involved with self-testing and menstrual hygiene and just a whole bunch of very exciting projects relating to women. And lastly, we did have someone last year who did an activity with the National University of Singapore, their Healthy Campus Initiative. So as I understand it, their Healthy Campus Initiative is a little bit similar to our Healthy Campus Initiative here. Remember, Singapore is not a poor country. It's more of a middle income or higher income country. So the opportunity would be similar to working here in some sense, but still might be fun. So there are some contact people, and if you have an interest, again, it would most likely be a remote opportunity, but you could start a dialogue, have a Zoom conversation, and learn more about what they have to say. So also in your packet, you'll see that we've also put in organizations with international health internship programs. Now, again, we don't know what these really are about now that everything has really gone remote, but we want to highlight a few of them just so that you're aware, because sometimes it pays to throw out your, I shouldn't say throw out, but, put your CV in a number of different pots and see what comes in the door, what the offers are. So the World Bank that's a tough one to get into because that's a global internship. They get applications. They've told me once they get usually about 3,000 a year for like 10 slots or something. So I don't know of any UCLA students who've ever gotten this, but there's always a first. But the deadline is coming up really fast, January 31st. So if you might want to do something with the World Bank, it's maybe worth throwing an application into their pool there. And they do pay expenses and things for students. So that's it's a paid internship. So that's why it has a lot of appeal. Secondly, apt associates. Dr. James Masinko has identified this opportunity where you, if you sign into apt associates, it's a major consulting organization, a collaborating agency based on the East Coast, I believe in the Boston area still, though they have offices in Washington. Anyway, you would upload your CV, upload other information about you, and then they would reach out to you if they think that there might be a fit. So it could be worth putting up a CV there and seeing what happens. Then we have Pan American Health Organization, and this is a subsidiary of the World Health Organization, but focused on the PAHO region. We generally do not recommend people do WHO internships in Geneva because essentially all they do is put you in a corner and you do a literature review for them. It's not very exciting. But with PAHO, we have had students working on a little bit more interesting kinds of things, and you can read about PAHO and how to apply. And then John Snow Incorporated, that's another organization like Apt Associates. And again, you can put in your application and see what they might match you with. Similarly, FHI 360, these are really excellent organizations that work they have a number, sometimes 30 or 40 different ongoing projects globally. So if there's a good fit, sometimes it can really be a great opportunity. And then we have also the International Rescue Committee. We've had 1 or 2 students in the past who did internships with them. PATH is another, Pathfinder another, and Gender Health another, Fundación BAI another. So these are all organizations which may or may not have active internships this year, but they all have in the past had internship programs, and all do recommend that you you submit an application to them, and they'll see if they can match you with something. We also want to call your attention to other helpful websites. So these are, for instance, University of Iowa. Dr. Masinko had found that they have a whole page of organizations that they recommend. But again, you have to then do all the spade work of trying to find out if there is an opportunity for you. But also Idealist or Rollins School of Public Health has a website, goabroad.com. So these are just websites with a lot of opportunities. This year, because we are all most likely going to be remote, a decision was made that you could do an internship with an immigrant organization if you would like to, or work with immigrants and have that count towards a global health certificate. So Sarah Blenner gave us a list of some possible organizations working with immigrant community that you might be interested in. Now, if for some reason, by the way, you're having trouble downloading this packet, Andrea can send you the packet also directly, so don't worry. So now I'm going to go back to our slides. And so Andrea interviewed former students, and I'm going to ask her to walk through this next slide and tell you sort of what people said about their internship last year, about what worked and what didn't work.
Yes, hello, thank you, Dr. Tavro. So as Dr. Tavro mentioned, I did have a chance to talk to our past interns, who of course didn't know that we were gonna have to do a remote internship, as we all didn't know. And we kind of just gathered some data on what works and what didn't work. So starting with what works, or what students reported that they enjoyed about their internship. As Paula mentioned, the ones that really did work was having a domestic preceptor or a contact person in the United States. As you can see, the biggest thing that did not work for students was the time difference. As Paula mentioned, some of that time difference can be very, very large. So that's one thing to take into account if your organization has at least a contact person in the United States that could be readily available to answer questions or have meetings with. And also internships that did work, they had a variety of tasks and projects. I think Paula just mentioned an internship where you just have to do a lit review or something like that all 10 weeks. And one of our students had an experience like that, so we didn't not advertise that internship. It was just one giant lit review. We find that internships that focus on one task can get pretty repetitive, but also isolating in a remote situation. Since you're all working from home, it can get kind of tedious to just go over the same task for 10 weeks. As Laura and Kirsten mentioned earlier, they both worked with Kana, and they kind of enjoyed being able to talk to other students and have a little bit of that community aspect in the remote setting. It is so important also if you're working with a lot of interns, maybe we did find an issue with having time with individual meetings with your preceptor. So if you are in a situation where there are a lot of interns in your organization, it is important to maybe carve out that time to have that weekly meeting that is required for students. And also great opportunities are one that incorporated learning opportunities. As Nilpa mentioned as well, that kind of enhance the curriculum that you're getting right now at UCLA. Kirsten mentioned, the static classes, those are really great. The weekly meetings with your preceptors are very, very important, especially in a remote situation. So you have feedback and, and guidance and direction. So we found that students that weren't able to get feedback often from their preceptors, either because of the time difference or because there were too many interns or a variety of reasons, that was a little bit tough for them in that remote setting. So it's very important, as I said, to carve out that time with them. And then lastly, some things that are interesting, and of course it's still early on in the process for internship, but if you're interested, a student did work with the faculty with the global data set, and they very much enjoyed that process. We have been reaching out to some faculty, as Dr. Tauber mentioned. We have one EPI internship at the University of Cape Town with Dr. Davey. Those seem to work very, very well for students because they have that contact with the UCLA professor and they're able to dive deep into the research. So if you're interested in, it's always okay for you to reach out to a faculty member and see if they have anything this summer. Of course, the list that we put together is definitely not an exhaustive list. We have been working on it for a couple of months now, so it's the most up to date we have. I did ask for you to sign in today because there are a couple of organizations that are still getting back to us on some internships, especially those that are located here in the United States, like a couple of organizations in San Diego and in Los Angeles that we find are especially valuable with this remote setting to have that local preceptor. So if you haven't put your name on that sign-in sheet, please do. We'll email out any opportunities that we get after this. And if you have any questions at all, I just put my name into the chat. Feel free to reach out and ask me about any of them, or if you need me to point you in a direction of contact person with a student or anything like that, just feel free to reach out and ask. Thank you. Not sure if that was everything that you
That
wanted me
was
to cover.
wonderful.
Okay.
Thank you so much. Then we'll move on to just two more quick slides. One is that sometimes when after you might have communicated through email and now you've set up your Zoom call, you can feel a little tongue-tied about what to ask, what to discuss. So we've talked to people and we've put together a quick little sheet of questions that others have said in the past that can be useful. So for instance, what will I be working on? Just because when you hear them discuss it, you can get a sense how vague they are, or if they're really specific and they understand it really well. What stage is the project in? So if the project is about to be launched, that can sometimes be a red flag because there can be delays. And so if they say, oh yeah, it's going to launch right before you arrive, could be problematic. On the other hand, if it's already operational and they're now looking to evaluate it, that could be a good opportunity. Or if they're in a planning stage and doing a needs assessment for a new project, that could be a good opportunity. But just to be aware that it's good to know, like, what stage is the project? Or if it's already done, all the data is collected, they're just really closing it down. That's also kind of a red flag, may not be the most exciting time. What other projects could I potentially work on? So that's if they really have only one, that's kind of, again, a red flag, because it's good to have a few things going on. One lags or gets hung up on some kind of thing, you can be working on something else. If it's not a remote opportunity, if you can travel there, then of course you would want to know, could I be in the field? Will I just be sitting in an office in, say, Nairobi, or will I actually be moving around a bit? Because ideally you'd be getting out into the field and seeing some things. Who else would I be working with? Are you just going to be alone working away on something, or are you going to be more of a team effort? Because that's often a bit more enjoyable. Is there a previous intern who you could put me in touch with? So really often the best opportunities are where they've had interns in the past and they know what is involved and what an intern likes to do and so on. If it's their very first time, that can also be a potential red flag that may need you to be much more proactive. But if they do have had past interns, and if the interns have good experiences, they generally should be happy to set you up with some interns to talk with. If they are refused, that could be, again, a warning sign. But they might say, well, let us reach out and then see if they're willing to talk to you. That's fine. I mean, you don't need to get their emails directly. And then you want to know, is the person you're talking to going to be your actual preceptor at the end of the day? Or is this just somebody who's like overall in charge of the organization, but you're going to be really working closely with somebody else? And you have to find out who that person is, how frequently you're going to be meeting. As Andrea said, ideally at the very least once a week. Even better is if it can be like twice a week. Do you have any suggestions for how to prepare for my internship? Because sometimes there's some background reading you could do, or they could send you reports ahead of time or things like that. So you're ready to go. And then, once you've asked some questions, it doesn't hurt to ask the person, what is your own background? Because again, remember, you do want to make sure that this person also has experience and would be a good person for you, and that they have also at least a master's. And then lastly, I've just thrown in a last one because I seem to find that the best internships also have you participating in meetings or conferences or symposia. So in other words, do they have staff meetings that you'll be part of, or project meeting team, or some mini conference or something, even if it's remote? But if not, again, it just suggests that it's going to be a less interesting internship. And lastly, just a few tips from past students. And I know you've heard this a lot now, but the word proactive, but don't just sit and stew. If you're really unhappy, you've got to be more active. And if things really aren't working out, you may need to jump ship. We have had that and had people pick up a different internship opportunity. But be proactive. If you're not hearing from the preceptor, nag them a bit, because they have committed to be your preceptor. And so, sometimes there are family emergencies and things like that are out of their control. But if they're just busy, well, they took you on. And so that really is their responsibility. And so you've got to be proactive. But if you're feeling frustrated, do call a session and tactfully as you can, talk about some of the problems. If you're really getting nowhere, definitely talk to your field studies supervisor. That person can also weigh in and help. And so think about what skills you really would like to develop during this summer. And also what, if you do some homework before your very first meeting, definitely look at the website of any organization, see as much as you could already glean, so that if they ask you, do you have any questions, you really can ask questions, or you're not asking a question that you easily could have known just from looking at the website. And lastly, think about the time zone issue. If they're 11 hours ahead, that is going to be difficult. If you're someone who always goes to bed early and they don't get into their offices until 9, which is 11 p.m. our time, it just really may not work very well. So that's why we're thinking, if you possibly could do an internship with an organization that's within, 3-hour difference or something from California, that would probably be ideal. But it doesn't mean you can't do one with another organization, but just to be aware of, you may need to get up at 5 a.m. say to participate in something, or stay up really late. And also consider some of the language barriers. So if there's going to be activities, but they will be doing that translation like Nilpa talked about, terrific, then you can really be involved. But if everything is going to be in the local language, it's going to really restrict your ability to participate. Also, I should say, don't presume that the internship is the opportunity to learn a language. It could be the opportunity to improve your skills in your language, but you've got to already walk in the door having a working proficiency, especially if it's like one of these Spanish-speaking countries. So here again are those helpful websites we discussed, and that's all that we have to share with you. So we'll just take 5 more minutes if there's any questions, any comments, anyone who's on this call. If you'd like to jump in and share anything, you're welcome.
question, if that's okay.
Sure.
If the organization that we're partnering with, or that we have an internship with, is okay with us coming in person, but will UCLA kind of block our chance to go, if that makes sense? Like if UCLA has a no travel policy still, but the organization is willing to let us go, is that a no-go for us going?
Joseph, that's a great question. And, we're all grappling with this, but I know that UCLA is committed to having in-person education in the fall. And I think so much of it is going to depend on vaccine rollouts, what happens globally. There's new strains of the virus, there's new issues. But my gut would be that if by the summer there is worldwide travel, things are going on, that you would be able to travel. That I don't think that UCLA would hold you back, because I know there's researchers, there's so many people who are just, counting the weeks until they can get on the road again. So I think it may be a case by case basis, but my gut would be that if there is that travel is open, the organization wants to have you there, they'd be doing the basic, what's needed to maintain safety, like mask wearing and so on, that I don't think you'd find that UCLA would hold you up.
Perfect, thank you.
Mm-hmm. Of course, this is such a dynamic situation. So we definitely expect every month we'll be getting new information and so on. So everything is up in the air right now. But if you've made those connections and you're lined up, and then there is an opportunity to travel, that you were thinking of doing something remotely, but now you really could travel to Cambodia or to Kenya or wherever, then I think that that's where the school wants to be able to assist you with airfare and so on if these opportunities arise. So there will be briefings for students, I think, every few months or something, if there's anything that changes. And Michelle Garcia will know if things change, particularly Dr. Alina Dorian will know. But for now, this is where we're at. It's that strange time. We have time, I think, for one more question, if there's any. Or another comment from anyone? Okay, well, thank you everyone so much. And do reach out to Andrea if you're having any trouble accessing slides or the packet. And this also is recorded, so we'll be posting this. I'm not sure exactly where at the moment, but it will be posted probably on the Global Health website.
Oh, sorry, I think there was a question in the chat.
Oh, I see. Yes, I did miss that. Sorry. What if things change in the middle of the internship? Should we immediately switch back to in-person internship? So in other words, if you're doing it remotely, could you potentially still travel if things change? I could imagine that might be a yes, but that would depend on resources available and decisions that are made. So if things suddenly change in July, say, I don't know if how the funding would work. But if you had the wherewithal yourself to go, then I could imagine you would be able to do so. But everything is very in flux at the moment. So, okay, well, thanks. I wish I could give you more specifics, but I hope this is helping you. And again, as Andrea said, you're welcome to find an internship anywhere in the world, but we just want to give you some help and support to make this happen. Okay, we'll stop it there. And Andrea, you can stop the recording. And